This is Megan Coons from Family 150 Section 3. I'm going to be telling you a little bit about a child life specialist today. The child life specialist typically works in the hospital setting. They are there to facilitate meeting the needs of the children and the families who are hospitalized. So for example, one of the things that they do is they coordinate playroom access, especially for children who are contagious or who have weakened immune systems. They will schedule playroom time for each of the kids that want to go to the playroom, and then they will clean all of the toys afterwards. And while they're in the playroom, a lot of the time they will give them activities that will kind of, stimulate their age level, whatever needs that they have at that point. Another thing that they do is they go and talk to both the family and the doctors, and they say, okay, here's what this family is not clear on. Can you please clarify that for them the next time you go around and do your rounds? Or they'll go into the family and they'll say, is there anything that you need? Is there anything that you're uncomfortable with? Is there anything that you're not sure about? And they'll make sure that the doctors communicate clearly with you after that. They also can provide support for the siblings as well. If there's one child who's hospitalized and then the siblings are there as well, they'll make sure that the siblings have what they need as well. Also, they do a lot of organizing for different volunteers who come in to help the children. So for example, volunteers who come in to do animal therapy, they bring their dogs or different animals. They will coordinate that and oversee those efforts. Another thing that they do is they educate the community about the needs of the children and their families. And they also sometimes they'll do outpatient consultation with the different families. And another thing, and this is probably one of the most stressful parts of their job description, is that they are in charge of making sure that the family has support in the case of a loss. So if their child ends up passing away, or even if they just have a really traumatic experience in the hospital, if the child has to have a pretty intensive surgery or something like that, they will make sure that that family has the support that they need. And that can be a stressor for this job. Another stressor is that there is a high demand for the clinical aspect of this. So in other words, a lot of the patients want to see the child life specialist, and they do have to try and make it around to all of the different patients each day. But on top of that, they are in charge of a lot of the paperwork and a lot of the organizing, like I had mentioned, organizing the volunteer groups and different things like that. So they do have to find a pretty good balance each day between how they spend their time to make sure that everything gets done. I mentioned earlier that the child life specialist typically works in hospitals. An example of a location that I know employs child life specialists is Children's Medical Center in Dallas. And one thing that I forgot to mention on their job description is that they will often help in a non-medical way with medical procedures. So an example of that is if a child has to have something like a feeding tube placed through their nose, the child life specialist would go into the room and bring toys and different things and try as best as she could or he could to distract the child and to try to help the child to be comfortable as much as possible during the procedure. So she wouldn't actually help with the medical aspect, but she would be there for support for the child and the family. And that's another stressful aspect of that job. Anyway, so the Children's Medical Center does employ many child life specialists. Some child life specialists are strictly on one certain floor, one certain wing of the hospital, or they'll work with a certain group. So for example, children with cystic fibrosis or children with cancer where their immune system is not where it should be, they have to have the playroom really clean so as not to spread disease and bacteria. And so typically they will have one child life specialist who just is always on that floor to make sure that that playroom is really sanitary. They have enough going on that floor that they'll stay there. Other child life specialists will rotate between floors depending on the needs of the children. And in addition to hospitals, a lot of child life specialists these days are starting to apply at different places like hospices even. They will apply at adult hospitals as well, and even some doctor's offices or outpatient healthcare facilities, just depending on the different needs there. The reason they would apply at a hospice or a hospital that's more for adults is because sometimes the parent is the one who is hospitalized, but the children are still very much affected by that. So the career field is starting to branch out a little bit from just children's hospitals. The child life specialist, the starting salary range is about $42,720, and the experienced salary range went up to about $71,487 a year, and that is for the director of the Child Life program. The educational requirement, the Child Life certification, the CCLS, would be required, and to obtain that you need to have a bachelor's degree, but you don't have to have it actually in psychology or in marriage and family or anything actually related, as long as you have certain classes covered. For example, family psychology, loss and grief, human anatomy, and physiology. And then in addition to the bachelor's degree, you need to have 480 hours of clinical work, and you need to pass an exam. So once you qualify for that, you will be a certified child life specialist. So I think that about covers it. Oh, the benefits also for the child life specialist are pretty standard. They have health insurance, dental, vision, retirement, and I actually saw that a lot of them even have tuition reimbursement. So it covers pretty much all of those standard things that you would consider. So that is the gist of a child life specialist. Thanks.